Once you're pregnant, and if it is a healthy, good, normal pregnancy, then there is no need for you to worry, and it usually doesn't require. And usually sexual intercourse doesn't lead to miscarriages. Most of the early pregnancies undergo miscarriages usually because of any chromosomal abnormalities or some genetic issues, and it has nothing to do with the sexual intercourse. That said, if you've been considered as a high-risk case, or if you have had any complications in the past, your doctor will definitely ask you to avoid being sexually active. And this is mostly in order to avoid any unplanned miscarriages. So it's always best to confirm with your doctor whether sexual intercourse is safe for you or not. What are the tips for safe and comfortable sexual intercourse during pregnancy? Hello everyone, this is Dr. Sneha Shetty, Clinical Director, Chief Fertility Specialist, Laparoscopic Surgeon and Gynaecologist working at Vriksh Fertility, HSR Layout and Whitefield. Does sexual intercourse during pregnancy lead to miscarriages? No. Once you're pregnant, and if it is a healthy, good, normal pregnancy, then there is no need for you to worry, and it usually doesn't require. And usually sexual intercourse doesn't lead to miscarriages. Now let me explain why. Once you're pregnant, your baby is surrounded by several layers of protective sheets like your amniotic sac, your uterine muscles, your cervical plug, etc., which act as a barrier against infections. These structures help keep the baby safe even during sexual intercourse. Most of the early pregnancies undergo miscarriages usually because of any chromosomal abnormalities or some genetic issues, and it has nothing to do with the sexual intercourse. That said, if you've been considered as a high-risk case, or if you have had any complications in the past, your doctor will definitely ask you to avoid being sexually active. And this is mostly in order to avoid any unplanned miscarriages. So it's always best to confirm with your doctor whether sexual intercourse is safe for you or not. Are there times when sexual intercourse is not okay during pregnancy? Yes. Some of the conditions include placenta previa, that is, if your placenta is little low-lying, covering the os or touching the os, then your chances of miscarriages may be on the higher side. Number 2, if you have any preterm labor risk. Number 3, if you have incompetent cervix or cervical insufficiency. That means if your cervix length, the mouth of the uterus, is called as the cervix. If that length is little bit smaller, then your doctor may ask you to refrain from sexual intercourse. Number 4, infections. If you or your partner are suffering from any infections, then your doctor may advise you to refrain from sexual intercourse. Number 5, in cases where unexplained vaginal bleeding or spotting is happening, even then your doctor may advise you to refrain from sexual intercourse. Now remember, every pregnancy is unique and only your doctor can guide you if it is safe or not. Is bleeding post-sexual intercourse in a pregnancy normal, and should you be worried about? Now here's what you should know about it. Minimum spotting and bleeding is actually quite common post-sexual intercourse if you're pregnant. During pregnancy, your cervix is usually quite sensitive and is having higher blood supply. So even slight sexual intercourse activity can sometimes lead to spotting or mild bleeding. Heavy bleeding or bright red bleeding, which is continuous like a flow, is something you should be worried about, and you have to meet your doctor immediately. What are the tips for safe and comfortable sexual intercourse during pregnancy? Number 1, open communication. Talk to your partner openly and communicate regarding any discomforts, emotional changes, and also changes in your desire, if any. Number 2, listen to your body. If it doesn't feel right, please stop immediately. Number 3, you can use any lubricants which are actually safe and which may help in your sexual intercourse. Next is being mindful of the pregnancy. Do not put too much pressure over your abdomen, as it can lead to discomfort and cause unnecessary complications.